starts now.
A new collaboration is expanding access to free contraceptive health care in Fresno County. It's also part of a larger effort to address the shortage of healthcare workers in the valley and state. Good afternoon. I'm Graciela Moreno.
And I'm Dale Yarong. Action News reporter Kate Nemrich joins us live from downtown Fresno to explain the new partnership and what it all means for local patients. Kate.
Hey Dale, Graciela, this partnership will allow UCSF Fresno to provide free contraceptive care to everyone they treat in the county. They already provide free health care to people throughout the county most in need, but state and federal leaders say this is just part of the effort to bridge the gap of health care in the county.
2.6 million. That's how many women in California live in what the state calls contraceptive deserts, meaning they don't have an easily reachable health center where they can get those services. University of San Francisco Fresno already operates a mobile health clinic, UCSF Fresno Mobile Heal, which provides free health care to underserved communities in the county. That includes agricultural workers, unsheltered people, and those living in rural communities. Now, it's partnering with Upstream USA and U.S. Department of Health and Human Services to expand to contraceptive care.
Mobile Heal is a grant and donation funded service that not only provides free care, but serves as a pathway for future healthcare workers in the region.
That training is key to addressing the ongoing healthcare worker shortage. Congressman Jim Costa, alongside U.S. Health and Human Services Secretary Javier Becerra, discussed ways local health leaders, state leaders, and the federal government could partner to help further reduce the shortage.
We need the state to say, we're going to invest in this as well, because there are 50 other states that would say, we'll put in money for you to come, and we have to make the best use of the scarce federal dollars that we get.
Both Costa and Becerra said a lack of educators is part of the reason we're seeing staffing shortages, and suggested ways to possibly overcome that hurdle.
If we could find a program that would increase the number of nurses around the country, in California included, why would we not make an investment? Because everyone is telling us there's a shortage. We just need a good idea so we can partner up. We can't be counted on to fund it 100%.
Costa highlighted some of the work already underway in the valley and state.
That's why this medical school that we're working on to become a full-fledged medical school with UCSF and University of California, Merced, and here in Fresno working with our healthcare facilities is so important that we move forward.
According to Fresno County health data, the teen birth rate here is more than 17%, well above the state average of 10%. That's why leaders say it was so important to add this free contraceptive care. In downtown Fresno, I'm Kate Nemrich, ABC 30 Action News.